Question 1. Strategic planning requires a comprehensive approach to rodent control in a densely populated urban neighborhood experiencing a significant increase in rodent sightings. Given the limited resources and the diverse socio-economic landscape of the community, which of the following strategies would be most effective and sustainable for the registered environmental health specialist/registered sanitarian to implement? Option A. Contract with a private pest control company to conduct extensive baiting and spraying operations across the entire neighborhood, with minimal direct involvement from the REHS/RES in ongoing monitoring or community outreach. Option B. Focus immediate efforts on distributing rodent bait stations throughout the neighborhood, assuming that reducing the rodent population directly will alleviate the problem. Option C. Develop and implement an integrated pest management (IPM) program that prioritizes sanitation, exclusion, harborage reduction, and community education on preventative measures, with targeted baiting or trapping as a supplementary measure only when necessary and under strict supervision. Option D. Organize a neighborhood-wide rodent trapping initiative, encouraging residents to set traps in and around their homes without prior comprehensive sanitation assessments or educational components. The correct answer is C. Develop and implement an integrated pest management (IPM) program that prioritizes sanitation, exclusion, harborage reduction, and community education on preventative measures, with targeted baiting or trapping as a supplementary measure only when necessary and under strict supervision. Explanation. Scenario analysis. This scenario presents a common implementation challenge in environmental health, where a seemingly straightforward pest control strategy encounters unforeseen complexities due to the interconnectedness of environmental factors and community engagement. The professional challenge lies in balancing the immediate need for rodent control with the long-term sustainability of the solution and the ethical considerations of public health interventions. A purely technical approach, without considering the socio-environmental context, is likely to fail. The REHS/RES must exercise sound professional judgment to identify the root causes and implement a holistic, evidence-based strategy. Correct approach analysis. The correct approach emphasizes an integrated pest management (IPM) strategy, which is the cornerstone of effective and sustainable rodent control under most environmental health regulatory frameworks, including those typically governing REHS/RES practice in the U.S. This approach involves a multifaceted plan that prioritizes prevention, sanitation, and habitat modification before resorting to chemical control. It aligns with the principles of public health by addressing the underlying conditions that attract and sustain rodent populations, thereby reducing reliance on potentially hazardous pesticides. This strategy is ethically sound, as it minimizes risks to human health and the environment, while achieving the public health objective of disease prevention and nuisance reduction. Regulatory compliance is inherent in an IPM approach, as it often involves adherence to guidelines from agencies like the EPA and state/local health departments that promote such integrated methods. Incorrect approaches analysis, focusing solely on bait stations without addressing sanitation and harborage issues, represents a failure to implement a comprehensive IPM strategy. This approach is reactive rather than proactive, treating the symptom, rodents, rather than the cause, attractants, and shelter. Ethically, it may lead to increased pesticide use, posing unnecessary risks to non-target organisms and potentially human health if not managed meticulously. Regulatory failure occurs because it bypasses the recommended preventative measures and may not meet the standards for effective pest management that prioritize source reduction. Implementing a community-wide trapping program without prior educational outreach or sanitation improvements is also problematic. While trapping can reduce immediate numbers, it fails to address the reasons rodents are present. This can lead to a continuous cycle of trapping and reinfestation, making it an inefficient and potentially costly solution. It also risks alienating community members if they perceive the effort as intrusive or ineffective, hindering future public health initiatives. Regulatory concerns arise from the potential for improper trap disposal and the lack of a sustainable, long-term solution. Relying exclusively on professional exterminators without active community involvement or oversight from the REHS/RES overlooks the critical role of public education and environmental modification. While exterminators are skilled in pesticide application, they may not have the broader public health mandate or the authority to enforce sanitation standards or habitat modifications. This approach can lead to a fragmented effort where the REHS loses control over the overall public health objective and the long-term effectiveness of the intervention. It can also be ethically questionable if it leads to over-reliance on chemical solutions without exploring less hazardous alternatives or addressing the root causes. Professional reasoning. When faced with such a challenge, and REHS should first conduct a thorough environmental assessment to identify the specific factors contributing to the rodent infestation. This includes evaluating sanitation practices, food sources, water availability, and potential harborage areas. Based on this assessment, a tailored IPM plan should be developed, prioritizing non-chemical methods such as exclusion, sanitation improvements, and habitat modification. Community engagement is crucial. This involves educating residents about their role in prevention, providing resources, and fostering cooperation. The REHS should then oversee the implementation of the plan, coordinating with pest control professionals when necessary, and monitoring the effectiveness of the interventions. This systematic, integrated, and community-inclusive approach ensures not only effective rodent control, but also promotes long-term public health and environmental well-being, adhering to professional standards and regulatory requirements. Question 2. Analysis of the historical environmental practices in a community experiencing a cluster of chronic respiratory illnesses. Considering the evolution of environmental regulations and public health understanding, what is the most appropriate approach for an REHS to assess the potential impact on current health outcomes? Option A. Conduct a comprehensive review of historical land use, industrial activities, waste disposal records, and relevant past and present environmental and public health regulations to identify potential legacy contamination and its link to current health issues. Option B. Attribute the current respiratory illnesses solely to recent industrial emissions without investigating older, potentially remediate sites. Option C. Recommend immediate cessation of all industrial activities in the area based on the current health cluster, without a detailed historical or scientific investigation. Option D. Focus exclusively on current environmental monitoring data and compliance with existing regulations, as past practices are no longer legally relevant. The correct answer is A. Conduct a comprehensive review of historical land use, industrial activities, waste disposal records, and relevant past and present environmental and public health regulations to identify potential legacy contamination and its link to current health issues. Explanation. Scenario analysis. This scenario is professionally challenging because it requires an environmental health specialist/registered sanitarian, REHS, to evaluate the long-term impact of historical environmental practices on current public health outcomes. This necessitates understanding the evolution of environmental regulations and public health awareness, moving beyond immediate problem-solving to a more comprehensive, historical perspective. The challenge lies in connecting past actions, often under different regulatory standards, to present-day health concerns and identifying appropriate interventions within the current legal and ethical framework. Correct approach analysis. The correct approach involves a thorough review of historical environmental data, public health records, and relevant past and present regulations. This allows for a comprehensive understanding of how past land use, industrial activities, and waste disposal practices, even if compliant with the standards of their time, may have contributed to persistent environmental contamination and subsequent health issues. This approach aligns with the REHS/RS's mandate to protect public health and the environment by identifying root causes and informing evidence-based interventions, respecting the evolution of scientific understanding and regulatory oversight. It demonstrates a commitment to proactive and informed public health protection. Incorrect approaches analysis. One incorrect approach would be to dismiss historical practices as irrelevant because they were legal at the time. This fails to acknowledge that scientific understanding and public health priorities evolve. Regulations are often reactive, and past practices, while compliant, may have had unforeseen long-term consequences that are now understood. Ethically, this approach neglects the REHS/RS's duty to address current public health risks, regardless of their historical origin. Another incorrect approach would be to focus solely on current regulatory compliance without considering the historical context. While current regulations are paramount, Ignoring the legacy of past environmental burdens can lead to incomplete assessments and ineffective solutions. This approach is procedurally correct in terms of current law, but ethically deficient in addressing the full spectrum of public health risks. A third incorrect approach would be to attribute current health issues solely to recent events without investigating potential historical contributing factors. This oversimplifies complex environmental health problems and can lead to misdiagnosis and inappropriate remediation strategies, failing to address the full scope of the environmental health history. Professional reasoning. Professionals should adopt a systematic approach that begins with defining the current public health concern. This is followed by a deep dive into the environmental history of the affected area, including land use, industrial activity, and waste management practices. Concurrently, a review of the evolution of relevant environmental and public health regulations is crucial. This historical context is then integrated with current scientific knowledge and regulatory standards to conduct a comprehensive impact assessment. Decision-making should prioritize evidence-based interventions that address both historical legacies and current risks, ensuring long-term public health protection and environmental sustainability. Question 3. The assessment process reveals that a restaurant has recently implemented a new hazard analysis and critical control points (HACP) plan for its food preparation. During a routine inspection, the registered environmental health specialist/registered sanitarian (REHS/RS) observed several staff members not consistently using gloves when handling ready-to-eat foods, a key control measure outlined in the new plan. The REHS/RS also notes that the temperature logs for the hot holding unit appear to be filled out, but the handwriting is difficult to decipher, and the temperatures recorded are at the lower end of the acceptable range. The REHS/RS needs to determine the most appropriate course of action to ensure public health is protected and regulatory compliance is maintained. Option A. Issue a verbal warning to the food service manager regarding the importance of following the HACP plan, assuming that the staff will correct their behavior without further documentation or verification. Option B. Focus on the overall cleanliness of the kitchen, which appears satisfactory, and overlook the specific deviations in glove use and temperature logging, trusting that the establishment is generally committed to food safety. Option C. Document the observed deviations from the HACP plan, including the inconsistent glove use and the illegible temperature logs, and discuss the potential public health risks with the establishment's management, recommending immediate corrective actions and follow-up verification. Option D. Advise the establishment to temporarily suspend operations until a more thorough review of their HACP plan can be conducted by a third-party consultant, as the observed issues suggest a fundamental flaw in their food safety system. The correct answer is C. Document the observed deviations from the HACP plan, including the inconsistent glove use and the illegible temperature logs, and discuss the potential public health risks with the establishment's management, recommending immediate corrective actions and follow-up verification. Explanation. The assessment process reveals a common challenge for registered environmental health specialists/registered sanitarians, REHS/RS, balancing the need for immediate public health protection with the procedural requirements of regulatory enforcement. In this scenario, the REHS/RS must evaluate the effectiveness of a newly implemented food safety protocol in a restaurant. The challenge lies in determining whether the observed practices meet the established standards for preventing foodborne illness, considering potential deviations and their implications. This requires a nuanced understanding of food safety principles, regulatory expectations, and the practical realities of food service operations. The correct approach involves a systematic and evidence-based evaluation that prioritizes the identification of critical control points and potential hazards, aligning with established food safety management systems and regulatory requirements such as those outlined in the Food Code, as adopted by the relevant U.S. jurisdiction. This approach emphasizes objective observation, documentation of deviations, and a clear understanding of the potential public health impact of any observed deficiencies. It represents best professional practice because it is grounded in scientific principles, adheres to legal mandates for food safety, and ensures a fair and consistent application of standards. The REHS/RS's role is to protect public health by ensuring compliance with regulations designed to prevent foodborne illness, and this method directly addresses that mandate. An incorrect approach would be to make a judgment based solely on the perceived cleanliness of the establishment, without a thorough assessment of the food handling processes. This fails to address the critical risk factors associated with foodborne pathogens, which can be present even in seemingly clean environments. Another incorrect approach would be to overlook minor deviations from the protocol, assuming they have no significant impact on food safety. This is problematic because even seemingly minor deviations can, under certain circumstances, compromise the integrity of the food safety system and increase the risk of illness. Ethically, this constitutes a failure to uphold the duty to protect public health. Furthermore, accepting anecdotal assurances from management without verifying compliance through direct observation and documentation is a significant professional failing. It bypasses the objective assessment necessary for regulatory enforcement and public protection. Professionals should approach such situations by first understanding the specific regulatory requirements and the established food safety plan. They should then conduct a comprehensive site assessment, focusing on critical control points and potential hazards. All observations, both compliant and non-compliant, must be meticulously documented. When deviations are identified, the REHS/RES must assess their potential public health impact and determine the appropriate course of action, which may include education, corrective action plans, or enforcement measures, all in accordance with established protocols and legal frameworks. This systematic and objective process ensures that decisions are defensible, effective, and uphold the highest professional standards. Question 4. Benchmark analysis indicates that a local food processing facility is producing a novel type of ready-to-eat snack bar containing a blend of grains, dried fruits, and a proprietary protein isolate derived from a non-animal source. The facility operates entirely within the state and distributes its products solely within the state. During a routine inspection, the registered environmental health specialist/registered sanitarian, REHS/RES, observes that the facility's sanitation procedures for the protein isolate handling appear to be less rigorous than those typically seen for dairy or meat products. The REHS/RES needs to determine the most appropriate regulatory framework to ensure the safety of this product. Option A. Apply the most stringent applicable federal regulations, FDA Food Code, and any specific state food safety statutes or regulations that may be more stringent, considering the product's ingredients and processing. Option B. Adhere strictly to FDA regulations for general food products and disregard any specific state-level food safety statutes or regulations, assuming federal law preempts state oversight in this instance. Option C. Implement generic food safety, best practices, and general sanitation principles without specific reference to federal or state codes, as the product is novel and distributed only within the state. Option D. Primarily focus on USDA regulations for protein processing, as the protein isolate is a key ingredient, and assume state regulations will align with these federal standards. The correct answer is A. Apply the most stringent applicable federal regulations, FDA Food Code, and any specific state food safety statutes or regulations that may be more stringent, considering the product's ingredients and processing. Explanation. Scenario analysis. This scenario presents a common challenge for environmental health specialists/registered sanitarians, ACE/RS, involving a potential violation of food safety regulations. The challenge lies in interpreting the applicability of different regulatory bodies, FDA, USDA, state, to a specific food product and determining the appropriate course of action based on the most stringent and relevant regulation. The EHS/RS must exercise sound judgment to ensure public health protection without overstepping jurisdictional boundaries or creating unnecessary burdens on the food establishment. Correct approach analysis. The correct approach involves identifying the primary regulatory authority responsible for the specific food product and then applying the most stringent applicable regulations, whether federal or state. In the U.S., the FDA generally regulates most food products, while the USDA oversees meat, poultry, and some egg products. State regulations often mirror federal standards but can be more stringent. Therefore, understanding the product's origin and processing is crucial. The EHS/RS must then assess compliance with the relevant food code, e.g., the FDA food code adopted by the state and any specific state statutes or regulations. This approach ensures that the highest standards of food safety are upheld, protecting public health effectively. Incorrect approach is analysis. One incorrect approach is to solely rely on USDA regulations when the product is not under USDA jurisdiction. This would lead to misapplication of standards and potentially overlooking critical FDA or state-level requirements. Represents a failure to accurately identify the governing regulatory body. Another incorrect approach is to only consider federal regulations and ignore potentially more stringent state requirements. State regulations are legally binding within the state and are designed to address specific local public health concerns. Ignoring them is a direct violation of state law and professional duty. A third incorrect approach is to apply generic food safety principles without referencing specific regulatory codes or statutes. While general principles are important, regulatory compliance requires adherence to established legal frameworks. This approach lacks the specificity and legal authority needed for enforcement and effective public health protection. Professional reasoning. Professionals should employ a systematic decision-making framework. First, identify the food product and its processing. Second, determine the primary federal regulatory agency, FDA or USDA, based on the product type. Third, consult the relevant federal regulations and the state's adopted food code. Fourth, identify any specific state statutes or regulations that may apply or impose stricter requirements. Fifth, assess the establishment's practices against the most stringent applicable regulations. Finally, take appropriate enforcement or educational actions based on the findings. This structured approach ensures comprehensive and legally sound decision-making. Question 5. Research into the implementation of a HAC plan at a local deli reveals that a critical control point, CCP, for temperature monitoring of cooked chicken has been consistently missed for the past 3 days due to a malfunctioning thermometer. The deli manager states that the chicken has been visually inspected and appears to be cooked thoroughly, and no customer complaints have been received. As the REHS, what is the most appropriate immediate course of action? Option A. Suggest that the deli temporarily adjust the critical limit for the CCP to account for the thermometer's inaccuracy, provided they can demonstrate the chicken is still being cooked to a safe internal temperature through other means. Option B. Recommend that the deli manager rely on their experience and visual inspection to ensure the chicken is safe, as HAC is a guideline and minor deviations are acceptable if no immediate harm is evident. Option C. Advise the deli manager that since no customer complaints have been received and the chicken appears visually cooked, they should continue with their current practices while ordering a new thermometer, and the HAC plan will be reviewed at the next scheduled inspection. Option D. Instruct the deli to immediately implement the corrective action procedures outlined in their HAC plan for this specific CCP, which includes taking the chicken out of service, investigating the root cause of the thermometer malfunction, and verifying the temperature of any remaining chicken using a calibrated, functional thermometer before serving. Correct answer is D. Instruct the deli to immediately implement the corrective action procedures outlined in their HAC plan for this specific CCP, which includes taking the chicken out of service, investigating the root cause of the thermometer malfunction, and verifying the temperature of any remaining chicken using a calibrated, functional thermometer before serving. Explanation. This scenario presents a common challenge for environmental health specialists / registered sanitarian A's/REHS working with food establishments. The core difficulty lies in ensuring the effective implementation of a hazard analysis and critical control points (HAC) plan, particularly when faced with a situation that deviates from established procedures. The professional challenge is to balance the need for operational efficiency with the paramount importance of food safety, adhering strictly to regulatory requirements. This requires a nuanced understanding of HAC principles and their practical application, as well as the ability to assess risk and make informed decisions that protect public health. The correct approach represents best professional practice because it directly addresses the deviation from the established HAC plan by initiating the corrective action process as mandated by HAC principles and regulatory frameworks. This involves identifying the deviation, implementing immediate corrective actions to regain control of the process, and then conducting a thorough investigation to determine the root cause and prevent recurrence. This systematic approach ensures that potential hazards are managed effectively, thereby safeguarding consumers from foodborne illnesses. It aligns with the fundamental purpose of HAC, which is to prevent food safety hazards before they occur. An incorrect approach that focuses solely on the immediate outcome without addressing the procedural failure is professionally unacceptable. This fails to uphold the integrity of the HACP system and the regulatory requirements that underpin it. Ethically, it prioritizes expediency over safety. Another incorrect approach that relies on anecdotal evidence or past experience without a systematic investigation is also flawed. This bypasses the critical step of root cause analysis, increasing the likelihood of recurring issues and potential food safety breaches. It demonstrates a lack of adherence to the structured decision-making process inherent in HACP and regulatory compliance. Professionals should employ a decision-making framework that prioritizes adherence to established protocols and regulatory mandates. This involves 1. Recognizing and documenting any deviation from the HACP plan. 2. Immediately implementing predefined corrective actions. 3. Investigating the root cause of the deviation. 4. Verifying the effectiveness of corrective actions. 5. Documenting all steps and updating the HACP plan if necessary. This structured approach ensures thoroughness, accountability, and continuous improvement in food safety management. Question 6. System analysis indicates a cluster of gastrointestinal illnesses reported by local healthcare providers, with several cases epidemiologically linked to patrons of a specific restaurant. As the lead REHS/RS, you are tasked with investigating this potential foodborne illness outbreak. Which of the following approaches best aligns with regulatory requirements and professional best practices for managing this situation? Option A. Advise the restaurant to voluntarily cease operations and implement extensive, unverified cleaning protocols based on rumors circulating within the community. Option B. Focus solely on interviewing patrons who have reported illness, assuming the restaurant is the sole source without investigating other potential contributing factors or food sources. Option C. Conduct a thorough epidemiological investigation, including interviews with affected individuals and restaurant staff, review of food handling practices, and environmental sampling, while maintaining open communication with the restaurant management and public health partners. Option D. Immediately issue a closure order for the restaurant based on the initial reports and media attention, pending a full investigation. The correct answer is D. Immediately issue a closure order for the restaurant based on the initial reports and media attention, pending a full investigation. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the registered environmental health specialist/registered sanitarian, REHS/RS, to navigate a complex foodborne illness outbreak investigation involving multiple stakeholders with potentially conflicting priorities. The REHS/RS must balance public health protection with the operational needs of food establishments and the legal requirements of food safety regulations. Effective communication, evidence-based decision-making, and adherence to established protocols are paramount to ensure a thorough and just investigation. Correct approach analysis. The correct approach emphasizes a systematic, evidence-based investigation that prioritizes public health while respecting due process for the involved food establishments. This aligns with the core mission of the REHS/RS to protect community health through the enforcement of food safety regulations. By focusing on identifying the source, implementing control measures, and collaborating with public health agencies, the REHS/RS upholds professional standards and regulatory mandates. This approach ensures that interventions are targeted, effective, and legally defensible, minimizing unnecessary disruption and reputational damage to businesses that are not implicated. Incorrect approaches analysis. An approach that prematurely assigns blame without sufficient evidence is a significant regulatory and ethical failure. This violates the principle of due process and can lead to unwarranted penalties, loss of business, and damage to the reputation of an establishment. It also undermines the credibility of the REHS/RS and the regulatory agency. Ethically, it is unjust to penalize an entity without a clear link to the illness. An approach that delays or obstructs the investigation due to pressure from stakeholders, such as business owners or political figures, is a direct violation of regulatory duties. The REHS/RS has a legal and ethical obligation to conduct a thorough investigation to protect public health. Compromising the investigation for external pressures is a dereliction of duty and can have severe public health consequences. An approach that relies solely on anecdotal evidence or assumptions, without rigorous data collection and analysis, is scientifically unsound and professionally unacceptable. Foodborne illness investigations require objective data, including epidemiological findings, laboratory results, and environmental assessments, to accurately identify the cause and implement appropriate control measures. This approach fails to meet the standards of evidence-based practice mandated by regulatory frameworks. Professional reasoning. Professionals should approach such situations by first activating established outbreak investigation protocols. This involves immediate notification of relevant public health authorities, securing and preserving evidence, and initiating a systematic data collection process. Communication with all stakeholders should be transparent, factual, and focused on the investigation's objectives. Decision-making should be guided by regulatory requirements, scientific evidence, and ethical considerations, ensuring that actions taken are proportionate to the identified risks and are aimed at protecting the public while upholding fairness. Question 7. The control framework reveals that a food processor, intending to expedite their production schedule, has proposed bypassing a critical control point within their hack plan related to the thermal processing of a ready-to-eat product. The processor asserts that their internal quality control measures are sufficient to ensure pathogen reduction, and that formal validation of this specific step is no longer necessary. The registered environmental health specialist/registered sanitarian, REHS/RS, overseeing this facility, what is the most appropriate course of action? Option A. Require the processor to provide scientific data or a detailed risk assessment demonstrating that the proposed deviation does not compromise the effectiveness of the thermal processing in eliminating or reducing target pathogens to acceptable levels, and that the hack plan may need revalidation. Option B. Inform the processor that any deviation from an approved hack plan is strictly prohibited and no further discussion will be entertained. Option C. Immediately approve the deviation based on the processor's assurance of their internal quality control measures and their desire to expedite production. Option D. Suggest the processor implement a novel, unvalidated antimicrobial wash as an alternative to the thermal processing step to achieve pathogen reduction. The correct answer is A. Require the processor to provide scientific data or a detailed risk assessment demonstrating that the proposed deviation does not compromise the effectiveness of the thermal processing in eliminating or reducing target pathogens to acceptable levels, and that the hack plan may need revalidation. Explanation. Scenario analysis. This scenario presents a professional challenge for an REHS/RS due to the conflict between a food processor's desire for expediency and the paramount public health mandate to ensure food safety. The processor's proposed shortcut bypasses a critical control point in their hazard analysis and critical control points hack plan, directly impacting the effectiveness of a preservation technique. The REHS/RS must navigate this situation by upholding regulatory compliance and ethical responsibilities without compromising food safety, while also considering the practicalities of food production. Correct approach analysis. The correct approach involves a thorough review of the existing hack plan and the proposed deviation. This aligns with the principles of the Food Safety Modernization Act, FSMA, and its emphasis on preventive controls. Specifically, the REHS/RS must determine if the proposed change constitutes a significant modification to the hack plan that requires revalidation. The regulatory framework mandates that any change that could introduce or increase a hazard or reduce the effectiveness of a control necessitates a review and potential revalidation of the hack plan. Best professional practice dictates that the REHS/RS should require the processor to demonstrate, through scientific data or risk assessment, that the proposed shortcut does not compromise the effectiveness of the thermal processing in eliminating or reducing the target pathogen to acceptable levels. This ensures that the critical control point remains effective in preventing foodborne illness, fulfilling the REHS/RS's duty to protect public health. Incorrect approaches analysis. One incorrect approach is to immediately approve the deviation based on the processor's assurance of speed and efficiency. This fails to uphold the regulatory requirement for a robust hack plan and the principle of preventive controls. It represents a significant ethical failure by prioritizing commercial interests over public safety and a regulatory failure by not ensuring the critical control point's effectiveness is maintained. Another incorrect approach is to rigidly reject any deviation without a proper risk assessment or opportunity for the processor to provide supporting data. While caution is warranted, an outright refusal without due process can be seen as an overreach if the processor can demonstrate the safety of the modified process. However, the burden of proof for safety lies with the processor, and the REHS/RS must ensure this proof is scientifically sound and meets regulatory standards. A third incorrect approach is to suggest an alternative preservation method that has not been validated for the specific product or processing condition. This could introduce new hazards or fail to adequately control existing ones, leading to potential foodborne illness and a violation of regulatory requirements for validated control measures. Professional reasoning. Professionals in this field must employ a systematic decision-making process. This begins with understanding the specific regulatory requirements, e.g., FSMA hack principles. Next, they must assess the proposed change against these regulations and the established hack plan. This involves gathering information, requesting supporting data from the regulated entity, and conducting a risk assessment. Ethical considerations, such as the duty to protect public health, must guide every step. When faced with a deviation, the professional should engage in a dialogue with the processor, explaining the regulatory basis for their concerns and outlining the necessary steps for demonstrating continued food safety. The decision should be based on objective evidence and regulatory compliance, not on convenience or pressure. Question 8. Which approach would be most effective for an REHS/RS to investigate a suspected foodborne illness outbreak involving multiple patrons experiencing gastrointestinal distress after consuming food from a local restaurant, where initial reports suggest a common meal was consumed? Option A. Rely solely on patrons' self-reported symptoms and dietary histories to determine the likely cause of illness without conducting an on-site inspection or collecting samples. Option B. Issue a public health advisory to the community warning about potential contamination at the restaurant based on initial anecdotal reports and defer detailed investigation until after the advisory is disseminated. Option C. Conduct immediate on-site interviews with affected patrons and food handlers, inspect food preparation and storage areas for sanitation deficiencies, and collect food and environmental samples for laboratory analysis to identify potential pathogens. Option D. Advise the restaurant to voluntarily close for a period of 48 hours, while the REHS/RS reviews patron complaint logs and available health department records. Correct answer is C. Conduct immediate on-site interviews with affected patrons and food handlers, inspect food preparation and storage areas for sanitation deficiencies, and collect food and environmental samples for laboratory analysis to identify potential pathogens. Explanation. This scenario presents a professional challenge because it requires an environmental health specialist/registered sanitarian, REHS/RS, to act decisively and accurately in a situation with potential public health implications. The rapid onset of illness among patrons of a food establishment, coupled with the identification of specific symptoms, necessitates a swift and systematic investigation to pinpoint the source and prevent further illness. The REHS/RS must balance the urgency of the situation with the need for thorough data collection and adherence to established protocols. The correct approach represents best professional practice because it prioritizes a comprehensive, evidence-based investigation aligned with regulatory requirements for foodborne illness outbreaks. This involves immediate on-site assessment, detailed interviews with affected individuals and food handlers, thorough inspection of food preparation and storage areas, and appropriate sample collection for laboratory analysis. This systematic process is crucial for identifying the causative agent, bacteria, virus, or parasite, the contaminated food item, and the contributing factors to the outbreak, thereby enabling effective control measures and preventing recurrence, in accordance with state and local public health codes and food safety regulations. An incorrect approach that focuses solely on immediate closure of the establishment without sufficient evidence fails to uphold due process and may cause undue economic harm. It bypasses the critical investigative steps needed to confirm the source and scope of the outbreak, potentially leading to misdiagnosis and ineffective interventions. Another incorrect approach that relies only on patron self-reporting without on-site verification or laboratory confirmation lacks the rigor required for public health investigations. This can lead to inaccurate conclusions and a failure to identify the true source, leaving the public vulnerable. An approach that delays sample collection or analysis until after initial symptom reporting, without considering the viability of pathogens or the degradation of evidence, compromises the integrity of the investigation and the ability to definitively link the illness to the food source. These failures represent a dereliction of professional duty and a violation of public health mandates. Professionals should employ a decision-making framework that begins with immediate risk assessment and notification of relevant authorities. This is followed by a structured investigation protocol that includes epidemiological data collection, environmental assessment, and laboratory confirmation. Throughout the process, clear communication with the food establishment, affected individuals, and public health officials is paramount. Adherence to established investigation guidelines and regulatory requirements ensures a thorough, objective, and effective response to foodborne illness outbreaks. Question 9. The review process indicates that a retail food establishment is storing prepackaged sandwiches containing potentially hazardous ingredients, e.g., deli meats, dairy-based dressings, on shelves at ambient room temperature, with the justification that they are freshly made and will be sold within a few hours. The establishment's manager states that customers prefer to see the sandwiches displayed at room temperature for selection. What is the most appropriate course of action for the registered environmental health specialist/registered sanitarian? Option A. Allow the current display method to continue as long as the sandwiches appear visually appealing and are sold quickly. Option B. Recommend that the establishment implement a system for customers to request sandwiches from a refrigerated unit behind the counter. Option C. Require the immediate refrigeration of all potentially hazardous prepackaged sandwiches to maintain them at or below 41 degrees F, 5 degrees C. Option D. Advise the establishment to clearly label the sandwiches as room temperature storage and to sell them within a strict 2-hour window. The correct answer is C. Require the immediate refrigeration of all potentially hazardous prepackaged sandwiches to maintain them at or below 41 degrees F, 5 degrees C. Explanation. This scenario presents a common challenge for environmental health specialists/sanitarians involving the interpretation and application of food safety regulations in a practical setting. The core difficulty lies in balancing the operational needs of a retail food establishment with the imperative to prevent foodborne illness, particularly when dealing with potentially hazardous food items and their storage. The professional challenge is to ensure compliance with the spirit and letter of the law, which prioritizes public health, without imposing undue burdens on the establishment that are not supported by regulatory requirements. The correct approach represents best professional practice because it directly addresses the identified risk by ensuring potentially hazardous foods are stored at temperatures that inhibit microbial growth, as mandated by food safety regulations. This aligns with the fundamental principle of preventing foodborne illness by controlling temperature. Specifically, it adheres to requirements for refrigeration of perishable foods to maintain them at or below 41 degrees F, 5 degrees C, or hot holding at or above 135 degrees F, 57 degrees C, depending on the food's intended use and preparation. This proactive measure is a cornerstone of retail food safety and directly mitigates the risk of pathogen proliferation. An incorrect approach that suggests allowing potentially hazardous foods to be stored at ambient temperatures for extended periods is a direct violation of food safety regulations. This failure to control temperature creates a significant risk of rapid bacterial growth, potentially leading to the production of toxins and subsequent foodborne illness. Ethically, this represents a dereliction of duty to protect public health. Another incorrect approach that focuses solely on the aesthetic appearance of the food, disregarding its temperature, is a critical regulatory failure. Food safety is not solely about visual appeal. It is fundamentally about preventing biological hazards. This approach demonstrates a misunderstanding of the core principles of food protection. Finally, an approach that relies on the establishment's claim that the food is fresh without verifying its temperature is a failure to conduct a proper inspection and to enforce regulatory requirements. The definition of fresh in a food safety context is intrinsically linked to its proper handling and temperature control, not just its perceived quality. The professional decision-making process for similar situations should involve a systematic assessment of the identified issue against applicable regulations. This includes 1. Identifying the specific food item and its classification, e.g., potentially hazardous. 2. Recalling the relevant regulatory requirements for its storage and handling, particularly temperature controls. 3. Evaluating the current conditions against these requirements. 4. Determining the level of risk posed by any noncompliance. 5. Implementing corrective actions that directly address the identified risk and ensure regulatory compliance, prioritizing public health. Question 10. The analysis reveals a food establishment is operating with a permit issued by the local health department that addresses general food safety practices. However, a recent state-level regulation has been enacted that imposes more specific requirements for temperature control of certain high-risk foods, exceeding the local ordinance's provisions. The establishment has been found to be in compliance with the local permit, but not the new state regulation. Which of the following represents the most appropriate course of action for the REHS/RS? Option A. Recommend that the establishment seek a variance from the state regulation, citing their existing local permit as evidence of adequate food safety practices, and continue to monitor compliance with local standards only. Option B. Issue a notice of violation for non-compliance with the state regulation, requiring immediate corrective actions to meet the more stringent temperature control standards, and inform the local health department of the state's regulatory authority. Option C. Inform the establishment that the local health department's permit supersedes the state regulation in this instance, as local authorities have primary jurisdiction over food establishments within their boundaries, and no further action is required. Option D. Advise the establishment that compliance with the local permit is sufficient, as it was issued by the governing authority for their operational area, and await further clarification or enforcement directives from the state. Correct answer is D. Advise the establishment that compliance with the local permit is sufficient, as it was issued by the governing authority for their operational area, and await further clarification or enforcement directives from the state. Explanation. This scenario presents a common challenge for environmental health specialists / registered sanitarians, REHS/RS, involving the interpretation and application of overlapping environmental health regulations at federal, state, and local levels. The core difficulty lies in determining which regulatory framework takes precedence when multiple jurisdictions have rules governing the same environmental health issue, and how to ensure compliance without creating undue burden or conflicting requirements. The correct approach involves a systematic evaluation of the regulatory hierarchy and the specific scope of each applicable law. Best professional practice dictates prioritizing the most stringent standard that provides the greatest level of public health protection, while also considering the intent and enforcement mechanisms of each regulation. This ensures comprehensive compliance and upholds the REHS/RS's duty to protect public health and safety. Incorrect approaches fail to adequately address the complexities of regulatory overlap. One common failure is to solely rely on the most recently enacted regulation without considering its superseding authority or specific applicability. Another is to apply only the local ordinance when a state or federal standard offers broader protection or addresses a more significant public health risk. Further pitfall is to assume that compliance with one level of regulation automatically satisfies all others, neglecting the possibility of specific, more detailed requirements at different governmental tiers. These failures can lead to inadequate public health protection, legal challenges, and a loss of professional credibility. Professionals should employ a decision-making framework that begins with identifying all potentially applicable federal, state, and local regulations. This is followed by a thorough review of each regulation's scope, intent, and enforcement provisions. The next step is to determine the hierarchy of authority, typically federal over state and state over local, unless specific preemption clauses exist. The most stringent applicable standard that effectively addresses the public health concern should then be identified and applied. Finally, communication and collaboration with relevant regulatory agencies at all levels are crucial to ensure a unified and effective approach to compliance and enforcement. Question 11. The audit findings indicate a statistically significant disparity in the prevalence of respiratory illnesses and proximity to industrial facilities across different census tracts within the jurisdiction. Specifically, census tracts with higher proportions of low-income residents and minority populations show a disproportionately higher burden of these illnesses and a greater concentration of regulated industrial sites. As a registered environmental health specialist / registered sanitarian, REHS/RS, what is the most appropriate course of action to address these findings in alignment with environmental justice principles and public health best practices? Option A. focus solely on enforcing existing environmental regulations at the industrial facilities, ensuring they meet all permit requirements, and issuing citations for any identified violations without further investigation into community health outcomes. Option B. Classify the audit findings as a statistical anomaly and recommend no further action, as the industrial facilities are currently operating within their permitted parameters. Option C. Recommend a public awareness campaign about general respiratory health, advising residents in all affected areas to take precautionary measures, without specifically investigating the link between industrial proximity and health disparities. Option D. Conduct a comprehensive environmental health assessment that explicitly investigates the disproportionate impact on vulnerable populations, engages with community stakeholders to understand their concerns, and advocates for policy and programmatic changes to address identified environmental justice issues and promote health equity. The correct answer is D. Conduct a comprehensive environmental health assessment that explicitly investigates the disproportionate impact on vulnerable populations, engages with community stakeholders to understand their concerns, and advocates for policy and programmatic changes to address identified environmental justice issues and promote health equity. Explanation. Scenario analysis. This scenario presents a professionally challenging situation because it requires the registered environmental health specialist/registered sanitarian, REHS/RS, to navigate the complex intersection of environmental regulations, public health outcomes, and social equity. The audit findings highlight a disparity in environmental burdens, which directly implicates environmental justice principles. The REHS/RS must move beyond simply identifying noncompliance to proactively addressing the root causes of these disparities and ensuring equitable protection for all communities. This requires a nuanced understanding of how historical and systemic factors can lead to disproportionate exposure to environmental hazards. Correct approach analysis. The correct approach involves a comprehensive assessment that explicitly considers the disproportionate impact on vulnerable populations and seeks to identify underlying systemic issues contributing to the observed disparities. This aligns with the core ethical responsibilities of REHS/RS to protect public health and promote environmental equity. By engaging with community stakeholders and advocating for policy changes that address the social determinants of health and environmental justice, the REHS/RS acts as a public health advocate, ensuring that regulatory efforts are not only technically sound, but also socially just. This proactive and community-centered strategy is the best professional practice, as it aims to achieve sustainable improvements in health outcomes for all residents, particularly those historically underserved. Incorrect approaches analysis. One incorrect approach focuses solely on enforcing existing regulations without acknowledging or investigating the disproportionate impact on specific communities. This fails to address the underlying environmental justice concerns and perpetuates existing inequities. Ethically, it represents a failure to uphold the REHS/RS's duty to protect public health comprehensively, particularly for vulnerable populations. Regulatory failure lies in not recognizing that compliance with minimum standards may not be sufficient to achieve equitable health outcomes. Another incorrect approach involves dismissing the audit findings as purely statistical anomalies without further investigation into potential environmental justice implications. This approach ignores the potential for systemic issues and historical disadvantages to contribute to the observed disparities. It is a failure to exercise due diligence and a lack of commitment to the principles of environmental justice, which are increasingly integrated into public health practice and regulatory oversight. A third incorrect approach might be to recommend solutions that are technically feasible, but do not involve community input or address the specific concerns of the disproportionately affected populations. This can lead to ineffective interventions that do not resonate with the community or address the root causes of their environmental health burdens. It represents a failure to engage in meaningful stakeholder collaboration, a key component of effective public health and environmental protection strategies. Professional reasoning. When faced with audit findings indicating environmental disparities, a professional REHS/RS should employ a decision-making process that prioritizes a holistic understanding of the issue. This involves 1. Acknowledging and validating the audit findings. 2. Investigating the potential for environmental justice concerns by examining demographic data, historical land use, and proximity to environmental hazards in relation to the affected communities. 3. Engaging directly with the affected communities to understand their lived experiences, concerns, and priorities. 4. Collaborating with relevant agencies and stakeholders to develop and implement targeted interventions that address both regulatory compliance and health equity. 5. Advocating for policy and programmatic changes that promote long-term environmental justice and health equity. Question 12. Governance review demonstrates that a local community is experiencing a significant increase in gastrointestinal illnesses, with residents attributing the outbreak to a recently opened food establishment. The REHS/RS is tasked with investigating this potential public health concern. Which of the following approaches best aligns with the principles of environmental health practice and regulatory compliance in this situation? Option A. Advise the public to avoid the food establishment until the investigation is complete, without directly engaging with the establishment or collecting evidence. Option B. Conduct a thorough epidemiological investigation to identify the source and mode of transmission of the illness, collect environmental samples from the food establishment for laboratory analysis, and review the establishment's food safety practices and records. Option C. Rely on the establishment owner's verbal assurances that all food safety protocols are being followed and close the case without further investigation. Option D. Immediately issue a closure order for the food establishment based on the volume of public complaints and the temporal association with the illness outbreak, pending a full investigation. The correct answer is D. Immediately issue a closure order for the food establishment based on the volume of public complaints and the temporal association with the illness outbreak, pending a full investigation. Explanation. This scenario presents a professional challenge due to the inherent conflict between immediate public health concerns and the need for thorough, evidence-based decision-making within established regulatory frameworks. The Registered Environmental Health Specialist/Registered Sanitarian, REHS/RS, must balance the urgency of a potential environmental health threat with the procedural requirements of investigation, data collection, and risk assessment, all while adhering to specific state or local regulations governing such situations. The correct approach requires a systematic, data-driven process that prioritizes public safety while respecting due process and regulatory mandates. The correct approach represents best professional practice because it aligns with the core principles of environmental health and the ethical obligations of REHS/RS. It emphasizes a structured investigation, including proper sampling and analysis, to gather objective data. This data then informs a risk assessment, which is crucial for determining the appropriate level of intervention. By consulting relevant regulations and seeking expert guidance, the REHS/RS ensures that actions taken are legally sound, scientifically defensible, and proportionate to the identified risk. This methodical process minimizes the likelihood of overreaction or underreaction, protecting both public health and the integrity of the regulatory system. An incorrect approach that relies solely on anecdotal evidence or public outcry without proper investigation fails to meet the regulatory requirement for evidence-based action. This can lead to misallocation of resources, unnecessary public alarm, or, conversely, a failure to adequately address a genuine threat. Ethically, it violates the principle of acting with competence and diligence. Another incorrect approach that involves immediate, drastic enforcement action without a thorough risk assessment and consideration of less severe alternatives may exceed the REHS/RS's authority and could result in legal challenges or damage to public trust. Bypasses the established procedures for due process and fair treatment of the involved parties. A third incorrect approach that delays action due to bureaucratic inertia or a reluctance to make a definitive judgment, despite accumulating evidence of a potential risk, represents a failure to uphold the primary duty to protect public health. This inaction can have severe consequences for the affected population and constitutes a significant ethical and professional failing. The professional decision-making process for similar situations should involve a clear understanding of the governing regulations, a commitment to objective data collection and analysis, a systematic risk assessment methodology, and a willingness to consult with supervisors, legal counsel, and other subject matter experts when necessary. The REHS/RES should always strive for transparency and clear communication throughout the process, ensuring that all actions are justifiable and documented. Question 13. During the evaluation of a potential lead contamination issue in a local community's drinking water supply, and REHS/RES identifies elevated lead levels in several residential samples that exceed federal action levels. The community is diverse, with a significant population of non-English speakers and varying levels of formal education. The REHS/RES needs to inform the public about the risks and recommend immediate precautionary measures. Which of the following communication strategies best aligns with the principles of effective public health communication and regulatory compliance? Option A. Organize a series of community meetings in accessible locations, utilizing interpreters for multiple languages, and providing simplified fact sheets in various languages that explain the risks of lead exposure, the recommended actions, e.g., flushing pipes, using filtered water and resources for further assistance. Option B. Advise residents to consult their personal physicians for information on lead exposure and its health effects, and to independently research potential solutions online. Option C. Distribute a technical report detailing the sampling methodology, laboratory results, and regulatory citations, available only in English on the local health department's website. Option D. Issue a press release to local media outlets that focuses on the scientific complexities of lead contamination and assures the public that the situation is being managed by experts, without providing specific actionable advice for residents. The correct answer is C. Distribute a technical report detailing the sampling methodology, laboratory results, and regulatory citations, available only in English on the local health department's website. Explanation. This scenario presents a common challenge for environmental health specialists/registered sanitarians, REHS/RES, involving the communication of complex environmental health risks to a diverse public. The challenge lies in translating scientific data and regulatory requirements into understandable and actionable information for individuals with varying levels of health literacy, cultural backgrounds, and trust in authority. Effective communication is paramount to ensuring public safety and compliance with environmental regulations. The correct approach prioritizes clear, culturally sensitive, and multimodal communication strategies that empower the community with accurate information and actionable steps. This aligns with the ethical responsibility of REHS/RES to protect public health and promote informed decision-making. It also reflects the principles of public health communication, which emphasize tailoring messages to specific audiences and utilizing trusted channels. Regulatory frameworks, such as those governing public information dissemination and community engagement, implicitly support such comprehensive communication efforts. An incorrect approach that relies solely on technical jargon and official documents fails to acknowledge the audience's comprehension levels and cultural nuances, leading to misinformation or a lack of engagement. This can result in noncompliance with public health directives and a breakdown in trust between the regulatory body and the community, potentially violating ethical obligations to serve the public interest. Another incorrect approach that dismisses community concerns as unfounded or overly emotional ignores the importance of community perception and lived experience in understanding environmental health issues. This can alienate stakeholders, hinder collaborative problem-solving, and create an adversarial relationship, undermining the REHS/RES's role as a trusted public health professional. It also fails to recognize that community concerns, even if not immediately scientifically validated, can highlight emerging issues or areas requiring further investigation. A professional decision-making process for similar situations should begin with a thorough assessment of the target audience, including their demographics, literacy levels, cultural beliefs, and existing knowledge about the issue. This should be followed by the development of a communication plan that utilizes a variety of methods, e.g., plain language fact sheets, community meetings, visual aids, local media engagement, and channels that are accessible and trusted by the community. Continuous feedback mechanisms should be incorporated to gauge understanding and adapt communication strategies as needed. Collaboration with community leaders and organizations can also enhance the effectiveness and reach of communication efforts. Question 14. Market research demonstrates a growing public concern regarding potential health impacts from a newly identified chemical compound detected in local groundwater. As a registered environmental health specialist/registered sanitarian, what is the most appropriate initial step to address this concern? Option A. Immediately implement widespread public advisories and restrictions on water usage until the chemical's effects are fully understood. Option B. Initiate a comprehensive environmental health risk assessment process, including hazard identification, dose response assessment, exposure assessment, and risk characterization. Option C. Conduct informal interviews with residents to gauge the perceived severity of the health concerns and base immediate actions on their feedback. Option D. Advise the public that current scientific literature does not definitively link the compound to adverse health effects, and therefore no action is necessary. The correct answer is B. Initiate a comprehensive environmental health risk assessment process, including hazard identification, dose response assessment, exposure assessment, and risk characterization. Explanation. Scenario analysis. This scenario presents a common challenge for environmental health specialists/registered sanitarians, A/RS, where a perceived environmental hazard requires a structured risk assessment to inform public health interventions. The challenge lies in moving beyond anecdotal evidence or public perception to a scientifically defensible evaluation of risk, considering both the hazard and the potential for exposure. This requires a systematic approach to ensure resources are allocated effectively and public trust is maintained through evidence-based decision-making. Correct approach analysis. The correct approach involves a systematic environmental health risk assessment process. This aligns with the core competencies and responsibilities of an EHS/RS as outlined in professional standards and often reflected in state and local environmental health regulations. This process typically includes hazard identification, dose response assessment, exposure assessment, and risk characterization. By following these steps, the EHS/RS can quantify the likelihood and magnitude of adverse health effects, providing a robust foundation for management decisions. This methodical approach ensures that interventions are proportionate to the identified risk and are based on sound scientific principles, fulfilling the ethical obligation to protect public health. Incorrect approaches analysis. One incorrect approach would be to immediately implement stringent control measures based solely on public outcry or media reports without conducting a formal risk assessment. This represents a failure to adhere to the principles of evidence-based practice and can lead to unnecessary economic burdens, public inconvenience, and a misallocation of limited public health resources. Ethically, it bypasses the due diligence required to confirm the existence and severity of a risk before imposing controls. Another incorrect approach would be to dismiss the public's concerns entirely due to a lack of immediate, definitive scientific data. While rigorous scientific evidence is paramount, ignoring public perception can erode trust and hinder future public health initiatives. An EHS/RS has a responsibility to investigate concerns and initiate appropriate assessment processes, even if initial data is inconclusive. This approach fails to acknowledge the importance of community engagement and proactive investigation. A third incorrect approach would be to rely on anecdotal evidence or personal observations as the sole basis for determining the presence and significance of the environmental hazard. While observations are a starting point for investigation, they do not constitute a risk assessment. This approach lacks the scientific rigor and systematic data collection necessary to characterize risk accurately, and can lead to biased conclusions and ineffective interventions. It fails to meet the professional standard of objective evaluation. Professional reasoning. Professionals should approach such situations by initiating a phased risk assessment. This begins with a preliminary investigation to gather initial information and determine if a formal risk assessment is warranted. If so, the process should follow established methodologies involving data collection, analysis, and interpretation. Transparency with the public regarding the assessment process and its findings is crucial. Decision-making should be guided by the risk characterization, considering the severity, likelihood, and potential for exposure, in conjunction with regulatory requirements and available resources. Question 15. Benchmark analysis indicates that a small artisanal soap-making business generates a liquid waste stream from its cleaning processes. The business owner states they do not use any listed hazardous chemicals and believes the waste is therefore non-hazardous. The business is seeking guidance on how to properly dispose of this waste. As a registered environmental health specialist/sanitarian, what is the most appropriate course of action? Option A. Recommend that the business dispose of the liquid waste in the municipal sewer system, as it is likely a dilute cleaning solution and not a regulated hazardous waste. Option B. Suggest the business owner simply pour the waste onto the ground behind their facility to allow it to evaporate, as it is a small volume and likely biodegradable. Option C. Advise the business owner to consult with a qualified hazardous waste management professional or laboratory to properly characterize the waste stream for hazardous characteristics, ignitability, corrosivity, reactivity, toxicity, before determining a disposal method. Option D. Inform the business owner that since they do not use any listed hazardous chemicals, the waste is presumed non-hazardous and can be disposed of in their regular trash. The correct answer is C. Advise the business owner to consult with a qualified hazardous waste management professional or laboratory to properly characterize the waste stream for hazardous characteristics, ignitability, corrosivity, reactivity, toxicity, before determining a disposal method. Explanation. Scenario analysis. This scenario presents a common challenge for environmental health specialists/sanitarians, REHS, involving the management of potentially hazardous waste generated from a small business. The core difficulty lies in balancing the business's operational needs with strict regulatory compliance for hazardous waste treatment and disposal, especially when the waste stream is not immediately obvious as a listed hazardous waste. The EHS/RS must exercise sound professional judgment to accurately characterize the waste, determine the appropriate management pathway, and ensure public and environmental protection without unduly burdening the business. Correct approach analysis. The correct approach involves a systematic process of waste characterization, which is the cornerstone of hazardous waste management under federal regulations like the Resource Conservation and Recovery Act (RCRA) in the United States. This process requires the generator to determine if their waste is hazardous, either by being a listed waste or by exhibiting a hazardous characteristic, ignitability, corrosivity, reactivity, or toxicity. For small quantity generator (SQG) or a conditionally exempt small quantity generator (SESC), understanding these characteristics is crucial for proper management. Consulting with a qualified hazardous waste management professional or laboratory for analysis is a best professional practice when the generator lacks the expertise or resources to perform accurate characterization. This ensures compliance with federal and state regulations, prevents improper disposal, and mitigates potential environmental and health risks. The EHS/RS's role is to guide and verify this process, ensuring the generator fulfills their responsibilities. Incorrect approach is analysis, an approach that assumes the waste is non-hazardous simply because it is not explicitly listed by name, is a significant regulatory failure. RCRA mandates that generators must also determine if their waste exhibits hazardous characteristics. This assumption bypasses a critical step in the waste determination process and could lead to the improper disposal of hazardous materials, posing risks to human health and the environment, and violating federal and state hazardous waste regulations. Another incorrect approach is to recommend disposal in the municipal solid waste stream without proper characterization. Municipal landfills are not designed to accept hazardous wastes, and their acceptance can lead to contamination of groundwater, soil, and air, as well as potential harm to landfill workers. This action directly violates regulations prohibiting the disposal of hazardous waste in non-hazardous waste facilities and demonstrates a failure to uphold the EHS/RS's duty to protect public health and the environment. Finally, advising the business to simply dispose of it as best they can, without providing specific guidance on characterization or regulatory requirements, is a dereliction of professional duty. This vague advice offers no actionable steps for compliance and places the burden of understanding complex regulations entirely on the business owner, increasing the likelihood of non-compliance and potential harm. It fails to provide the necessary technical expertise and regulatory oversight expected of an EHS/RS. Professional reasoning. When faced with a waste stream of unknown hazardous potential, the professional decision-making process for an EHS/RS should always begin with a thorough understanding of the generator's responsibilities under applicable hazardous waste regulations, e.g., RCRA in the U.S. This involves guiding the generator through the waste characterization process. If the generator cannot perform this characterization themselves, the EHS/RS should recommend seeking assistance from qualified professionals or laboratories. The ultimate goal is to ensure the waste is managed in a manner that protects human health and the environment, in full compliance with all relevant federal, state, and local laws. This requires a proactive, investigative, and educational approach, rather than making assumptions or providing vague advice. Question 16. Regulatory review indicates that a new commercial car wash facility is being constructed within the 500-foot sanitary control radius of a public groundwater while serving a community of 5,000 people. State regulations clearly define this radius as a critical zone, where specific land use restrictions apply to prevent groundwater contamination. The facility is designed to discharge wastewater directly to a storm drain system that eventually flows into a nearby surface water body, but initial site runoff during construction has been observed to contain oils and detergents. What is the most appropriate regulatory action for the registered environmental health specialist / registered sanitarian, REHS/RS, to take? Option A. Issue a verbal warning to the construction site supervisor about the potential for runoff contamination. Option B. Advise the community to increase the frequency of their water testing for contaminants like oils and detergents. Option C. Issue a formal notice of violation citing the specific state regulations prohibiting or restricting such commercial activities within the sanitary control radius, and requiring the facility to implement immediate containment and management of construction site runoff, as well as a plan for managing operational wastewater to prevent discharge into the storm drain system. Option D. Recommend that the public water system operator upgrade their filtration system to handle potential contaminants from the car wash. Correct answer is C. Issue a formal notice of violation citing the specific state regulations prohibiting or restricting such commercial activities within the sanitary control radius, and requiring the facility to implement immediate containment and management of construction site runoff, as well as a plan for managing operational wastewater to prevent discharge into the storm drain system. Explanation. Scenario analysis. This scenario is professionally challenging because it requires an environmental health specialist / registered sanitarian, REHS/RS, to interpret and apply specific state regulations concerning the protection of a public drinking water source from potential contamination. The challenge lies in identifying the most appropriate regulatory action based on the observed activity and its potential impact. Balancing public health protection with practical enforcement. Careful judgment is required to ensure compliance with the Safe Drinking Water Act (SDWA) and relevant state-level implementing regulations, which often have detailed requirements for source water protection zones. Correct approach analysis. The correct approach involves identifying the specific regulatory provisions that prohibit or restrict activities within a designated wellhead protection area or sanitary control area. This aligns with best professional practice by directly addressing the potential risk to the public water supply as mandated by federal and state law. The SDWA, through its Source Water Protection Program and state-specific regulations, provide the framework for preventing contamination at the source. And REHS/RS has a professional and ethical obligation to enforce these regulations to safeguard public health. Incorrect approaches analysis. One incorrect approach would be to simply issue a verbal warning without documenting the violation or initiating formal enforcement. This fails to establish a regulatory record, provides no assurance of future compliance, and neglects the REHS/RS's duty to enforce established public health laws. It represents a failure to uphold the regulatory framework designed to protect water sources. Another incorrect approach would be to focus solely on the immediate visual impact of the activity without considering its potential for long-term contamination of the groundwater. This demonstrates a lack of understanding of hydrogeology and the insidious nature of groundwater contamination, which can have delayed and severe public health consequences. It bypasses the preventative intent of source water protection regulations. A third incorrect approach would be to recommend a treatment solution for the water supply without addressing the source of the contamination. While treatment is a critical component of public water systems, the primary responsibility of an REHS/RS in this context is source protection. Ignoring the source violation and focusing only on downstream treatment is a regulatory and ethical failure, as it does not prevent the problem from occurring in the first place and may lead to increased treatment costs and complexity. Professional reasoning. Professionals should approach such situations by first identifying the specific water source and its designated protection zone according to state regulations. They must then assess the observed activity against the prohibited or restricted activities within that zone. The next step is to consult the relevant state statutes and administrative codes to determine the appropriate enforcement action, which may range from a notice of violation to a formal order. Documentation is paramount, and communication with the responsible party should be clear, referencing specific regulatory requirements. If there is ambiguity, consulting with legal counsel or senior regulatory staff is advisable. The ultimate goal is to prevent contamination at the source, thereby protecting public health and ensuring compliance with the law. Question 17. The assessment process reveals that a routine water quality sample collected from a public water system shows preliminary results indicating the presence of a pathogen, commonly associated with gastrointestinal illness at levels that are suggestive of a potential public health concern, though confirmatory testing is still pending. The water system operator is aware of these preliminary findings, but has not yet been formally notified by the laboratory or the health department. As the REHS/RS responsible for overseeing this water system, what is the most appropriate immediate course of action? Option A. Immediately issue a public health advisory to consumers of the water system, recommending boiling water for consumption, while simultaneously expediting the confirmatory laboratory analysis and formally notifying the water system operator. Option B. Wait for the official, confirmed laboratory report to be finalized before taking any public health action or notifying the water system operator, to avoid causing unnecessary alarm. Option C. Inform the water system operator of the preliminary findings and instruct them to conduct their own internal investigation and testing before any external notifications are made. Option D. Advise the water system operator to immediately shut down the water system and issue a do not use order until all testing is complete, without public notification, to prevent any potential exposure. Correct answer is A. Immediately issue a public health advisory to consumers of the water system, recommending boiling water for consumption, while simultaneously expediting the confirmatory laboratory analysis and formally notifying the water system operator. Explanation. Scenario analysis. This scenario presents a professional challenge due to the conflict between immediate public health concerns and the established protocols for sample collection and analysis. The registered environmental health specialist/registered sanitarian, REHS/RS, must balance the urgency of a potential outbreak with the need for scientifically sound evidence to guide intervention. The ethical dilemma lies in deciding whether to act on preliminary, unconfirmed information or to adhere strictly to procedures, potentially delaying critical public health responses. Correct approach analysis. The correct approach involves initiating immediate public health notifications and advisories based on the preliminary findings, while simultaneously expediting the confirmatory testing process. This aligns with the REHS/RS's core responsibility to protect public health. Regulations, such as those governing the Safe Drinking Water Act (SDWA) in the U.S., emphasize the importance of timely notification to consumers when contaminants exceeding maximum contaminant levels (MCL) are detected or suspected. Ethically, the principle of beneficence, acting in the best interest of others, dictates prioritizing public safety. Expediting confirmatory testing is crucial to validate the initial findings and to determine the precise nature and extent of the contamination, thereby enabling targeted and effective control measures. Incorrect approach is analysis. Acting solely on preliminary, unconfirmed data without initiating confirmatory testing would be a regulatory and ethical failure. While acting quickly is important, making definitive public health pronouncements without robust scientific backing can lead to unnecessary panic, economic disruption, and erosion of public trust. This approach bypasses the established scientific and regulatory framework for validating water quality data, which is designed to ensure accuracy and prevent erroneous actions. Delaying any public health notification until full confirmatory testing is completed, even with strong preliminary indicators, represents a significant ethical and regulatory lapse. The SDWA and related state regulations mandate public notification within specific timeframes when violations occur or are suspected. Delaying notification, even with the intention of ensuring accuracy, could expose the public to harmful contaminants for an extended period, violating the duty to protect public health and potentially leading to illness or death. This approach prioritizes procedural adherence over immediate public safety, ignoring the preliminary findings altogether and waiting for routine testing schedules to address the situation is a severe dereliction of duty. This approach demonstrates a lack of professional diligence and a failure to recognize the potential for an acute public health threat. It directly contravenes the REHS/REHS's mandate to investigate and respond to potential environmental health hazards promptly. Professional reasoning. Professionals facing such dilemmas should employ a risk-based decision-making framework. This involves 1. Assessing the potential severity and likelihood of harm from the suspected contaminant. 2. Evaluating the reliability of the preliminary data. 3. Considering the regulatory requirements for notification and action. 4. Consulting with relevant authorities and subject matter experts. 5. Communicating transparently with the public about the situation, including the preliminary nature of findings and the steps being taken. The goal is to achieve the most effective public health protection while maintaining scientific integrity and regulatory compliance. Question 18. Governance review demonstrates a pattern of recurring violations related to improper food temperature control in a specific food service establishment. The establishment has received multiple citations over the past year for holding potentially hazardous foods at temperatures above 41 degrees F, 5 degrees C, during cold holding. Considering the goal of process optimization to prevent future occurrences, which of the following actions by the registered environmental health specialist/registered sanitarian, REHS/RS, will be most effective in addressing the root causes of these repeated issues? Option A. Focus future inspections solely on verifying cold holding temperatures during peak service hours, documenting any deviations with photographic evidence. Option B. Advise the operator to purchase additional thermometers and instruct staff to check temperatures more frequently without investigating the existing equipment or workflow. Option C. Issue a final notice of violation with a significantly increased penalty, citing the repeated nature of the offenses and recommending immediate replacement of all refrigeration units. Option D. Conduct a detailed analysis of the establishment's food receiving, storage, preparation, and service procedures to identify specific points where temperature control is compromised, and collaboratively develop a revised operational plan with the operator that includes staff training and equipment maintenance schedules. The correct answer is D. Conduct a detailed analysis of the establishment's food receiving, storage, preparation, and service procedures to identify specific points where temperature control is compromised, and collaboratively develop a revised operational plan with the operator that includes staff training and equipment maintenance schedules. Explanation. This scenario presents a common challenge for environmental health specialists/registered sanitarian As/RS, where a food service establishment has a history of recurring violations related to improper food temperature control. The challenge lies in moving beyond simply citing violations to identifying and addressing the root causes to prevent future occurrences and ensure public health protection. A governance review highlighting this pattern necessitates a proactive and systemic approach rather than a reactive, one-off inspection. The correct approach focuses on process optimization by engaging the food service operator in a collaborative problem-solving effort. This involves understanding the establishment's current food handling procedures, identifying specific points of failure, e.g., equipment malfunction, inadequate staff training, inefficient workflow, and working with the operator to implement sustainable corrective actions. This aligns with the principles of food safety management systems, which emphasize prevention and continuous improvement. Regulatory frameworks, such as those derived from the FDA Food Code, which forms the basis for many state regulations, promote a risk-based approach to food safety, prioritizing interventions that have the greatest impact on reducing foodborne illness. By optimizing processes, the EHS/RS is not just enforcing rules, but fostering a culture of food safety within the establishment, which is the ultimate goal of public health protection. This approach also demonstrates ethical responsibility by prioritizing the prevention of harm to the public. An incorrect approach would be to solely rely on issuing citations and penalties without addressing the underlying systemic issues. This reactive approach, while fulfilling the immediate requirement of documenting noncompliance, fails to prevent recurrence. It can lead to a cycle of repeated violations, increased enforcement costs, and a continued risk to public health. Ethically, This approach is deficient as it does not adequately protect the public from potential foodborne illness. Another incorrect approach is to assume the operator is unwilling or unable to improve and to recommend drastic measures like license suspension without first attempting a collaborative, process-oriented intervention. This is premature and may not be justified by the evidence of systemic failure. It also fails to uphold the principle of providing opportunities for correction and improvement. A third incorrect approach is to focus solely on the symptoms, e.g., a single temperature reading, without investigating the cause. This leads to superficial fixes that do not address the root of the problem, such as a faulty thermometer or a poorly maintained refrigeration unit. This is a failure in thorough investigation and risk assessment. Professional decision-making in such situations requires a systematic approach. First, thoroughly investigate the recurring violations to understand the scope and frequency. Second, engage the operator in a discussion about the observed issues and their potential impact. Third, collaboratively identify the root causes through process analysis. Fourth, develop a corrective action plan with clear timelines and measurable outcomes. And finally, follow up to ensure the plan's effectiveness and provide ongoing support or further intervention as needed. This iterative process of assessment, intervention, and evaluation is crucial for effective public health protection in food service sanitation. Question 19. Implementation of an environmental health investigation into a cluster of respiratory illnesses in a community, and REHS/REHS must assess the potential impact of local industrial emissions. Which approach best aligns with the principles of environmental epidemiology and biostatistics for impact assessment? Option A. Focus solely on the statistical significance of a single air pollutant measurement without considering the overall emission profile or the duration of exposure. Option B. Conduct a comprehensive review of existing air quality monitoring data, correlate temporal trends with reported illness rates, and investigate potential exposure pathways and dose-response relationships while considering confounding factors. Option C. Rely on community reports and anecdotal evidence of symptoms to immediately attribute the illnesses to the industrial emissions. Option D. Prioritize the economic impact of potential emission controls over the thorough investigation of the health cluster. The correct answer is B. Conduct a comprehensive review of existing air quality monitoring data, correlate temporal trends with reported illness rates, and investigate potential exposure pathways and dose-response relationships while considering confounding factors. Explanation. This scenario is professionally challenging because it requires an environmental health specialist/registered sanitarian, REHS/REHS, to move beyond simple data collection and engage in the interpretation of epidemiological findings to inform public health interventions. The core challenge lies in translating statistical associations into actionable public health strategies while adhering to established regulatory frameworks and ethical considerations. The REHS/REHS must demonstrate a nuanced understanding of environmental epidemiology and biostatistics, recognizing that correlation does not equal causation and that multiple factors can influence health outcomes. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based methodology for impact assessment. This involves clearly defining the scope of the investigation, identifying relevant exposure pathways and health outcomes, and employing appropriate epidemiological study designs and statistical analyses. The regulatory framework for REHS/REHS professionals emphasizes the importance of data-driven decision-making and the protection of public health. By focusing on establishing a plausible link between environmental exposures and observed health effects, and considering the strength of evidence, dose-response relationships, and biological plausibility, this approach aligns with the ethical obligation to act in the best interest of the community. It also adheres to the principles of environmental justice by ensuring that potential health impacts are thoroughly investigated and addressed. An incorrect approach that relies solely on anecdotal evidence or public perception fails to meet professional standards. This is an ethical failure because it bypasses rigorous scientific inquiry, potentially leading to misallocation of resources or ineffective interventions. It also represents a regulatory failure as it deviates from the requirement for evidence-based public health actions mandated by environmental health regulations. Another incorrect approach that focuses only on the statistical significance of a single variable, without considering confounding factors or the broader context of environmental exposures is also professionally unacceptable. This is a failure in biostatistical interpretation, leading to potentially misleading conclusions and ineffective public health strategies. It can also be an ethical failure if it leads to the dismissal of a genuine public health concern due to an incomplete analysis. Professionals should employ a decision-making framework that begins with clearly defining the public health problem and the environmental factors potentially involved. This involves a thorough literature review, consultation with subject matter experts, and the development of a robust investigation plan. The plan should outline the data collection methods, study design, and statistical analyses to be employed. Throughout the process, professionals must maintain objectivity, critically evaluate the evidence, and consider potential biases and limitations. Ethical considerations, such as community engagement and transparent communication of findings, should be integrated into every stage of the impact assessment. Question 20. Risk assessment procedures indicate that a former industrial site, operational from the 1950 to the 1980, is being considered for redevelopment into a public park. Historical records are sparse, but include general descriptions of waste disposal practices common for that era. Given the evolution of environmental science and regulations regarding hazardous materials and their long-term health impacts, which approach would be most professionally sound for assessing the potential environmental health risks to future park users? Option A. Immediately mandate extensive remediation based on the assumption that any industrial activity from that period inherently poses an unacceptable risk, regardless of specific historical practices or current data. Option B. Conduct a comprehensive site investigation using current environmental sampling and analysis techniques, comparing results against contemporary regulatory standards for soil and groundwater contamination, while also reviewing historical records for insights into potential contaminants and their likely migration pathways based on past practices. Option C. Rely solely on the limited historical records to infer the types of waste disposed of and assume that since practices were compliant with regulations of the time, no significant current risk exists. Option D. Focus exclusively on current site conditions and potential recreational hazards, disregarding all historical operational data as irrelevant to present-day risk assessment for a public park. The correct answer is B. Conduct a comprehensive site investigation using current environmental sampling and analysis techniques, comparing results against contemporary regulatory standards for soil and groundwater contamination, while also reviewing historical records for insights into potential contaminants and their likely migration pathways based on past practices. Explanation. Scenario analysis. This scenario presents a professional challenge by requiring the registered environmental health specialist/registered sanitarian, REHS/RS, to interpret historical environmental data in the context of evolving public health understanding and regulatory standards. The difficulty lies in determining the appropriate level of current risk based on past practices that may not have been considered hazardous at the time of their implementation. This necessitates a nuanced understanding of both historical context and contemporary scientific and regulatory frameworks. Correct approach analysis. The correct approach involves a thorough review of historical records, including past inspection reports, permits, and any available environmental monitoring data, coupled with an understanding of the scientific knowledge and regulatory standards prevalent during the time these activities occurred. This historical context is then critically evaluated against current scientific understanding of health risks and contemporary environmental regulations. This method represents best professional practice because it is grounded in a comprehensive, evidence-based approach that acknowledges the evolution of environmental health science and policy. It allows for an objective assessment of current risk by considering the past without being solely dictated by it, adhering to the principle of protecting public health based on the best available current knowledge and standards. This aligns with the ethical obligation of an REHS/RS to apply current scientific principles and regulatory requirements to ensure public safety. Incorrect approach is analysis. One incorrect approach would be to solely rely on the historical records without considering current scientific understanding or regulatory standards. This fails to acknowledge the advancements in environmental health science and the establishment of more protective regulations over time. Ethically and professionally, This is unacceptable as it could lead to an underestimation of current risks and a failure to implement necessary protective measures, thereby jeopardizing public health. It violates the REHS/RS's duty to apply current best practices. Another incorrect approach would be to apply current, stringent regulatory standards retroactively to historical practices without considering the context of the time. While the intent might be to ensure the highest level of safety, this approach can be legally and practically unfeasible and may not accurately reflect the risk at the time. It can lead to misinterpretations of historical compliance and potentially unfair judgments. A professional REHS/RS must apply regulations and scientific understanding relevant to the period in question when assessing historical context, while still ensuring current risks are addressed. A third incorrect approach would be to dismiss historical data entirely and focus only on current conditions, ignoring any potential legacy issues. This is flawed because past activities, even if compliant with historical standards, can have long-term environmental impacts that continue to pose a risk. Ignoring this history prevents a complete and accurate risk assessment, potentially leaving residual hazards unaddressed. Professional reasoning. When faced with historical environmental data, a professional REHS/RS should employ a systematic approach. 1. Gather all relevant historical documentation, including permits, inspection reports, and any available monitoring data. 2. Research the scientific understanding and regulatory standards that were in effect during the period the historical activities occurred. 3. Evaluate the historical practices against these past standards to understand compliance at the time. 4. Critically assess the potential for ongoing or legacy environmental impacts based on current scientific knowledge of health risks. 5. Apply current environmental health principles and regulatory requirements to assess the present-day risk posed by the historical activities or their consequences. 6. Document the entire process, clearly articulating the rationale for conclusions drawn, considering both historical context and current public health protection.